Dr. Neville Okwiri. I'm an ENT surgeon and ENT consultant working with the Nairobi ENT clinic, but based in Kisumu. And my special area of interest when it comes to ENT is actually otology. And this is a sub-branch of ENT that deals specifically with disorders of the ear and hearing. When it comes to pediatric neck lumps or masses, then there are a variety of reasons that this could be. And when it comes to that, we tend to look at them generally in two main classifications. Is it congenital, meaning that the child was born with it, or is it acquired, something that the child tends to get somewhere down along the line? So amongst the congenital masses then, which tend to be about 50% of the masses that we see in young children, most of them are noticed either at birth or soon thereafter, as opposed to the acquired neck masses that then would tend to be masses that one notices as the child tends to grow older. That being said, congenital neck masses can still be noticed in much older children. And so for you as the parent, whenever you notice a swelling or a lump on your child, it is imperative for you to seek the advice of an ENT doctor. As I've alluded to earlier, that the causes are generally grouped into two main categories. That in which one is born with, the congenital ones, or that in which one gets later. So for the congenital masses, they tend to be what we call cystic in nature, in that when you feel them, they tend to be boggy and as if they're filled with fluid. And many of this usually arise as a result of a disorder when it comes to embryonic development. Now the acquired ones again fall into very many categories, but the most important ones could be due to infections. This could be viral infections, this could be bacterial infections. And then, unlike adults, for pediatric neck masses, we are not as worried about tumors, be they benign, meaning or malignant. So for the most masses, they tend to be the one that a child is born with, or if they acquire it, then they tend to be more often than not infectious. Usually before we rush off and do a battery of tests, you as the parent, as the guardian to this child, has a lot to tell us in terms of what you've noticed about this neck lump. When did you notice it? Is it growing larger? Does it change? For instance, when the child is agitated or crying, does it grow larger? Is it painful to touch? Does the child have any other symptoms? Is he feverish? Is he refusing to feed? Is he losing weight? These can all be pointers towards the sort of tests that we are going to do. So when we are thinking about most of the congenital masses, then the radiological investigations are extremely important. And the ones that we tend to go to first could be your CT scan, which gives us a very good delineation of the masses, the anatomic structure within the neck, and for us to be able to tell where exactly does this mass arise from. Other tests could include an MRI scan and an ultrasound, especially if we are thinking about masses that could be arising from the child's thyroid gland. Other investigations usually include some blood works to look at the child's hemoglobin level, his white cell count, and so forth, especially for infectious causes, for neck masses. And other, even much more advanced tests can be done to be able to delineate what could be the cause of this mass that you're seeing. When we worry about cancer, then more often than not, we have to do something called a surgical biopsy. And this is one which a surgery is done to remove a piece of the mass so that it can be able to then be tested by a pathologist in the laboratory for him to be able to characterize the type of cells. Are they the kind of cells that will mutate out of order and lead to a malignant tumor, or what exactly is the exact nature of this lump that your child has? So the treatment options range from wait and see to aggressive surgery, depending very much so on what the nature of this mass is. Now, for a vast majority of these children, they tend to have what we would call reactive nodes or hypertrophic nodes. And these are masses that are usually less than 2 centimeters. They tend not to be painful, tend not to come with any other symptomatology, that is fever or irritability or weight loss or pain. And they tend to be usually quite small, rubbery and mobile when you touch them. And usually these ones do occur, but they're of no consequence. So for these ones, we usually just advise the parent, the guardian, that this is something that does occur in certain individuals, but it is nothing to be very worried about. So we keep a keen eye on the child and we see him over a duration of time to ensure that no other symptomatology arises. Now, for most of the congenital ones, those ones in which the child is born, then usually the mode of management for these ones would actually be surgical excision. And this is done usually, in fact, virtually all the time under general anesthesia. And this will mean that your child will be taken to theater. And what you're trying to do is you're trying to remove this mass in total and to be able to allow the child to have more or less a normal development and not to have aesthetically masses that can be quite disfiguring. And as the child grows older, then some of these masses tend to grow larger as well. When you come to the cancerous masses then, for the neck, the most common type of cancer that we find in children are usually what are referred to as the lymphomas. And when it comes to management of the lymphomas, our role as ENT surgeons usually is in its diagnosis. But once a diagnosis has been made of a lymphoma, then we usually then have to refer this child to an oncologist, that is a cancer specialist, who will then be able to take up the management of this child.